Hello, I'm Raina Morgan with iHealthTube, visiting with Dr. Aaron Katz, the author of Prostate Health. You first came into holistic medicine, where you first were exposed to it, at the Atkins Center.
Yes.
The famous Dr. Atkins?
Yes, that's correct.
Could you describe that, how that affected you?
Well, it's incredible how sometimes a phone call can change your career. We got a phone call at our university. They needed a urologist to go and down to the Atkins Center and evaluate prostate patients. And I started doing that when I first came to Columbia in 1993. And it was an eye-opening experience, really, for me, to the number of patients that were being cared for there with herbal and nutritional therapies, therapies that I never knew existed and didn't realize would have such great benefit. And it was amazing that if I would go there on a Tuesday and treat men at that center with herbs and diet and prevent them from undergoing surgery, and yet when I went back to the medical center on a Thursday, we'd be up there seeing the same type of patient, yet offering them surgical therapy, because that's how we were trained at the medical center.
What a contrast.
So it was an amazing contrast, and it was, again, an eye-opening experience for me into this whole healthcare area of complementary and alternative medicine, or what I like to refer to more as integrative medicine, is trying to evaluate these patients, make sure that we do a proper diagnosis, use our skills that we learned in allopathic medical schools, and then open our eyes and listen to our patients and allow them to receive some of the best of the alternative medicine as well as the allopathic medicine to give them really the best health care that they can receive. And many times, especially for patients with early stage prostate cancer that undergo treatments, traditional treatments like surgery or radiation, they come to me because they say, you know, Dr. Katz, I'm a high-risk patient. I've been treated conventionally, but I have a high risk of this cancer coming back. What can I do? What can I change in my life? What can I add to my diet? What can I do to reduce my stress to prevent this cancer from returning?
And a traditional doctor would not really have those answers, would he?
Well, I think the traditional doctor, again, hasn't been educated and wasn't trained in this area. And I think one of the goals and the missions of our center at Columbia is really to try and educate ourselves, our patients, and other physicians through evidence-based research and clinical trials and studies that we're doing so that we can learn about these other approaches.
So a patient who has received surgery might also be using herbs and more holistic approaches to healing, right?
Oh, very commonly. In fact, if we were to do a survey of men in this country that have prostate cancer, that are concerned about their PSA returning or their cancer returning, an overwhelming number of them, just on their own, without the advice of a physician or without seeking medical advice, are taking some of these things, nutrients and dietary modifications, to prevent cancer recurrence.
So they could see someone like yourself and have both approaches, and that's integrative medicine.
That's integrative medicine, exactly.
Okay, well, thank you, Dr. Katz.
Thank you.